I read about Mahavatar Baba, and next to my Baba's picture in my puja room is Mahavatar Baba's Baba. So I consider him as the highest spiritual leader.
Yes.
I have been an oncologist for over 50 years. The Sushumna Kriya Yoga, which is a very simple technique with a profound benefit, will definitely, in my view, I have no doubt to say that it will complement your treatment. For any cancer to occur in any organ, the starting point is inflammation. It changes the cell, a normal cell to a cancer cell. So you have to address the inflammation before it becomes inflammation. Amma, namaskar Amma, welcome to my house.
Sadgurubhyo Namaha, Om Sushumna. In all humility and reverence, I bow down to the lotus feet of Paramagurus, Shri Bhoga Siddhar, Shri Mahavatar Babaji, and Pujya Guruma, Her Holiness, Shri Aathmanandmayi Mataji. Welcome to Sushumna, the Inner Miracles. Today, we have the immense privilege of speaking to a global pioneer in the field of oncology. Dr. Nori Dattatreyudu is renowned for his groundbreaking contributions in cancer. Dr. Garu is not only a great oncologist, but also an advocate of humanity and service. Professor Dr. Nori Dattatreyudu is a world-renowned radiation oncologist. He was the principal investigator for numerous clinical trials sponsored by the National Cancer Institute and has received countless national and international awards, including the Distinguished Alumnus Award of the Memorial Sloan Kettering Cancer Center. He was presented the highest civilian award in the United States of America, the Ellis Island Medal of Honor in 2014, and received the fourth highest civilian award of India, Padma Shri, in the year 2015 for his contribution to the field of medicine. Dr. Nori Dattatreyudu has trained about 300 residents who have become chairmen of academic departments in the United States. He has also written numerous books on cancer research. He has penned hundreds of articles and had lectured at prestigious international venues. He has over 4.5 decades of experience in cancer care. Dr. Nori Dattatreyudu is the living legend of cancer care. Namaskaram, Dr. Garu.
Namaskaram, good morning.
Om Sushumna. Yes. Dr. Garu, you have achieved great success in your life. And to whom do you attribute this success to?
I come from a family who are highly philosophical, spiritual. So that remained with me throughout my life, my mother, my father. So part of that is coming from them, and a part of this is from my own. I believe so everything is done by a supernatural power. You may call God different names. And also, I also believe as an oncologist, as a doctor, that when science stops, spirituality starts.
That's true.
So you cannot leave one without the other.
That's true. That's
so
true.
Most of the doctors I see here in the US and also in India, they may be in a wrong direction to some extent, that they feel that they can do anything. But they have to accept there is a supernatural power guiding us that determines what you do or what you are not able to do.
Dr. Garu, could you take us through your upbringing in India?
Upbringing in India, I'm one of the 12th child in my family, a big family, a very poor family. I lost my father at age 4.
Oh.
And I told you my father also is a very philosophically minded, spiritual leader and a teacher, school teacher.
Okay.
And he went to conduct a Purana in one ashram in near Vijayawada, where we come from, called Mantada,
Okay.
between Uyur and Pamaro.
Okay.
So he went there to deliver Purana, Ramayana, and he went there, and on the day of Sri Ramanavami, he took a bath in one of the side rivers next to it, and he passed away in that because of the gush of water suddenly released into the canal.
Okay.
On Sri Ramanavami day.
Okay.
So for all of us, my family, that place is very auspicious for us, the Kurumadali.
Okay.
So whenever we go to India, I go to India every 3 months, I had to go there and pray to Amma. Siddha Purusha was there, Kurumadal Amma.
Okay.
And what my father did is, we come from a poor family, I told you. Only 1 acre of land we have. He donated it to ashram.
Oh.
So that Ammagaru said, I will protect your family because whatever you have, you sacrifice to us.
Wow.
So that has become reality, that all my brothers grew up and occupied big positions. One has helped the other one and gave a support to the next guy. So my mother also is like a God to us.
Okay.
If you
What's your
ask,
bond with your mother, Dr. Garu? Tell us about your bond with your mother.
Yeah, bond with my mother is a very, very intense.
Wow.
If you ask me too many questions, I cry. That is the kind of bondage I have with my mom.
Okay.
Because being a last child in the family, I was with her all the time.
Okay.
So everybody got educated, left, they're doing their jobs, but I'm with her every day, every time, all the years. So I practically saw her sacrifices. What kind of sacrifice she did to grow the family, to educate my brothers, to get my sisters married. And I still remember that when one of my brothers needed to pay exam fee for a BA or MA, she used to give the only one gold bangle she had. She used to sell it and pay for the tuition fee.
Okay.
I can witness her sacrifices in a personal level. So one time she gave away her bangles, even, tears come to my eyes if I say the next one. She even gave her Mangal Sutras to pay for education.
Wow.
So my guru, my God, my mother, everything is my mother for me. So whenever I go to India, I went when she was alive. She passed away at 94 in Hyderabad.
Okay.
She was staying with my brother, one of my brothers.
Okay.
So the mother's bondage, the affection, love, is you cannot measure it. One time I was coming from Russia and stopped in India and gave her a call. I was in Hyderabad. I landed in Hyderabad. I didn't want to tell anyone that I'm coming. I want to give a surprise. So I called my mother first. She said, Nana, eppudu vachavaru nu? When did you come? So that is the affection. Amma, how do you know? I'm your mother. I know where you are.
Wow.
So that is very profound. So my mother is everything for me, and to my brothers, my sisters. In my puja room here, you have seen that. During her mental faculty was very good, even 94, very good. She was mobile and she is a devotee of Lalita Lalitambuka.
Yeah.
And she passed away on Vijayadashmi Day.
Wow. With your surname, in fact, there are a lot of Sri Vidya Upasakas
Yes.
back in India.
Yeah.
So I think spirituality comes from there.
Yeah, spirituality comes from there. The Nori, a lot of generations are there.
Yes, yes. Yes,
I found out that why, they are not together. They said that most of these Noris are Somayajas, that means doing
Yes.
homams,
Homams,
havans and
yes.
everything, yajnas.
Yes. Mm.
So they want to, if there is any issue with the family, some issue, they cannot perform yajna, so they got separated. So
How was your mom's faith in God, Dr. Garu?
Mom's faith in God is incredible.
Okay.
Without doing the Sahasranama, Ammavari Sahasranama, she won't touch anything.
Oh, okay.
And I think she has Sakshatkara of Ammavaru also.
Wow, that's good.
That's the reason we all believe, family believes, that she passed away on Vijayadashmi Day. So she is everything for me, for my family. And she has, we provided her with a small table during her last few years for taking her lunch and breakfast.
Okay.
So I bought the table, it is in the puja room here.
Oh, okay.
So I remember her every minute, every day. And when I'm driving to Manhattan, I either euphoria or anything you may call, but I talk to her as if she's sitting next to me in the car.
Wow, that's nice. She's definitely there in spirit.
Yes, yeah.
If not in form, she's definitely there in spirit.
Yeah.
She's there in your heart.
Yeah, thank you.
Dr. Garu, Vivekananda says that education is a manifestation of perfection already in man. You've taken up medicine and you've done amazing research. What propelled you to take up medicine?
Medicine is one area of specialty where you are in touch with the patient.
Yes.
There's no other specialty in our arts section or medical other section. You are dealing with the patient who is suffering.
That's true.
You are relieving her suffering, her or him is suffering. And the satisfaction you get from that, you cannot measure it with money.
That's right.
And I have, being an oncologist, even in more intense connection with the patient.
That's correct.
They don't come to me with cough or appendicitis. They come to me with a serious problem.
And there's so much of intense emotion because most of them are on the deathbed.
Yes.
And to deal with them is extremely difficult.
Yeah.
So,
So the attachment is very intense. So
Yes.
what I reassure my patients, that's one of the reasons I am very not well known around the world. I take up challenging cases. People come to me from all over the world with
Yes.
challenging problems when everyone give up.
Yes.
And I use my knowledge, my expertise in science, and use some spirituality also. Pray to Baba.
Okay.
Give me a good plan how to treat this patient. So I am blessed to say that I cured so many patients where everybody gave up on, including big universities, UK, USA. But I use my science and spirituality.
So from where does this intuition flow, Dr. Garu? At what point do you get these suggestions from divine?
I do prayer every day before I go to work.
Okay.
So I clear my mind. I put my entire day's program in front of God. This is what I'm going to do.
Okay.
And guide me. They didn't come to me for nothing. They came to me with suffering, with some serious cancer, serious problem. So allow me to help them. You send them to me.
Okay.
So you better guide me how to treat them.
So what is that relationship that you share with God? Is he a friend? Is he a mentor? He or she, I mean. How is that bond and how is that association?
Yeah, the association is it's a good question. You start with the Almighty, God, the superpower, like He is the commander-in-chief of the entire universe. The more you do devotion and go close to God, you can call Him whatever you want.
That's right.
Your mother, father, friend, guide, and sometimes I even demand Him certain things.
Wow.
Look, I've been doing this for you. Why don't you help this patient? Why did you send in the first place to me? I can't see the suffering, the family crying, the kids asking me whether my mother would be alive or not. How can I answer? So I challenge Baba, my God is Shirdi Sai Baba. I challenge him almost every time I have a critical case. And also when he creates certain situations, sometimes very happy, then I tell him, is it necessary? When sometimes not very happy, so is it necessary for you to create this drama for me?
Oh.
So this continuous being in touch. And if people ask me, this is maybe saying a little bit too much about my spirituality. When do you pray to Baba? People ask me, when do you pray to Baba? In the morning, in the night, or in the afternoon? I tell them, when am I not praying to Baba?
Oh, wow. That's nice. That's wonderful.
Every minute, every second.
Dr. Garu, when did you really develop service orientation? Was it there back in your family, or you developed it over time after dealing with your patients and witnessing all the suffering that they experience?
Service mentality was there from the beginning for me.
Okay.
From the beginning, even my high school, college days, I'm very moved by anybody suffering with anything.
Oh.
And the way I was brought up is always be helpful. Always be helpful. So that has a very good footing in my mind, that I share happiness in sharing my wealth, my knowledge, my everything with others. And anything I do, I must first give to others. To feel good, then I'll feel good. When they are enjoying, I feel good. So this nature has come to me naturally or through Baba. It became more and more intense that whatever I do, others must also enjoy. So the area of specialty really solidified what I do. That I want to make sure that the patient, if I can cure them, I'll cure them with all the current knowledge, technology, everything. If I cannot cure them because of their package of fate, I tell them I'll be with you until the last minute. Don't be afraid. Don't be afraid. Don't be fearful. I'll be with you. One patient I treat patients from all over the world. One patient came to me from Israel.
Okay.
A long time ago. And she went to England, and this is the usual story. They go to all the countries, everybody says, can't do anything. Go to America.
Mm-hmm.
So in America, they go to all the universities, big time names. Everybody says, go to Dr. Nori. He's the only one who can save you. So I developed some new techniques and cured them. Their difficult situation. And they are very happy. They got their kids married, their grandkids with them. And one lady wrote me, every year he sent me a New Year greeting card. The last year greeting card she sent me, it makes me very happy.
Wow.
That is, dear Dr. Nori, we celebrated, my husband and me, my grandkids, great-grandkids, celebrated my 60 years of wedding anniversary.
Wow.
I said, I'm very happy.
Wow.
But the next sentence really made me cry. Not cry, it made me feel very good. And we celebrated 60 years of wedding anniversary, Dr. Nori. 30 years of which is given by you.
Ah, wonderful.
So that is the kind of happiness you get when you cure people.
Dr. Garu, a lot of medical practitioners, they say that you have to disown the patient. You can't be empathetic to your patients if you have to treat them. This is something that commonly we get to see in most of the medical practitioners. But your way of treating patients is totally different. So when you have that bond with your patients, what is that deep feeling, deep sense of emotion that you experience? Can you articulate?
Yeah, yes, this is a very good question. They developed a deep bond with me.
Yes.
And vice versa. I also developed a deep bond because you give them life.
Yes.
They feel it. They know it. So my bondage with my patients is more than with my family.
Wow.
So when I travel all over the world, when I go to countries, they come and receive me at the airport. They know I'm a vegetarian. They say, take me to a vegetarian restaurant.
Oh.
So that I don't feel that kind of freedom when I go to a distant cousin's house.
Okay.
Like when I meet my patients. So that bondage is very important for me and for them also. For them also. That's what I teach also in the new generation of oncologists. You don't treat the patient as a number, another number. No, they have a family behind.
Yes.
When somebody has cancer, it hits the whole family.
That's right.
Not only the patient. So consider the whole family as your family. So I'm lucky that way that God has given me the blessing of helping so many people.
Dr. Garu, today our lifestyle is fast paced and there is all pervasive stress. Do you think that stress is a trigger to cancer?
There is no doubt.
Okay.
All these stress, anxiety, apprehension, worry, all these trigger a reaction in the body, produces oxidants or toxins. The toxins have to go somewhere.
Correct.
They can go anywhere, any tissue, any organ in the body.
Okay.
They will start a process called inflammation.
Okay. Okay.
A process called inflammation. For any cancer to occur in any organ, the starting point is inflammation.
Oh my God.
Inflammation, you know what is
Yes,
inflammation.
yes.
It's not infection, inflammation.
Inflammation, yes.
Inflammation is the starting point, and if there is a chronic inflammation, not healing, you are not taking care of it, it changes the cell, a normal cell to a cancer cell. So you have to address the inflammation before it becomes inflammation. How do you do that? There are a number of ways. Luckily, in our Hindu tradition, Sanatana Dharma, and our culture, we have these yogic techniques, meditation techniques. These are, I strongly believe, these are cleansing the body from all these toxins.
Okay.
No doubt about it. And people who have done randomized studies or clinical studies in America have proved once for all that the stress level, anxiety level goes down with meditation yoga. No doubt about it. There is recent data also that the meditation and yoga technique which we practice has profound effect on every single organ in the body. Wow. Endocrine system, central nervous system, cardiovascular system, everything. So here is, the more I learn about or read about yogic techniques, yoga techniques, meditation techniques, I believe that God has given us, especially from our culture,
Correct.
a simple technique, but with profound effects on the body. You're not taking any pill. You're sitting in one place and then reducing your stress level by yourself if possible, and then concentrating on one point or depending on your guru's instructions, and relax the body and detoxify the body. It's a mental, physical detoxification. What best you can expect? You cannot request anything other than that. So I strongly believe whatever I just said, that medical doctors can give prescriptions for ailments, but people who are aspiring for tranquility, peace, calmness, there's no other physical medicine I can give except yoga.
Meditation. Dr. Garu, if it has to be a choice between yoga and physical exercise, what would you suggest?
What would I suggest is physical exercise is for physical body.
Okay.
Yoga is for mental and soul.
Okay.
So if you can combine both, no harm. If you cannot combine, if you're in a good shape, you feel that you're in excellent shape, concentrate on yoga.
Okay. Dr. Garu, I would like to listen to some of the tips from you so that we will be able to prevent cancer on daily basis. What are some of the things that we need to follow so that we can keep cancer away?
Good question. Good question. Now, I will say a few points from my experience. One is know your body.
Okay.
That is, cancer won't happen suddenly.
Okay.
The body is giving you signals. Pay attention to the signals. If something, some ailment, some symptom is not going away, seek advice.
Okay.
Because if it's an ordinary thing, it will go away. It's not going away, means, so pay attention.
Okay.
Yesterday, the people say, suddenly this lump appeared, it was not there. Like, no, it was there, you didn't notice it.
Okay, okay.
A symptom was there for 3 months, you did not pay attention.
Mm-hmm.
So like that, so pay attention to your body, very important.
Okay.
Second one is pay attention to your family history. After all, you are carrying the genes.
That's true.
So if your mother, your aunt have breast cancer in the family, you go for checkup little early. Instead of 50 years, start your checkups 45 years. Oh. The same thing with prostate cancer in males.
Okay.
So pay attention to, even though you may not like your aunts, know what they have, at what age they have those problems. Okay. That will give you a lot of clues. And then diet and exercise. What you eat is very important. And I told you some of the diets, especially Western diet, it produces incredible inflammation in the body. These fried foods.
And unfortunately, the influence is too much in India also.
Yeah, it's influencing very badly in India right
Processed
now.
Food, fat food.
So be watchful what you eat. And one thing in India, I said that a diet is that one, vegetarian diet. I'm a vegetarian, lifelong vegetarian. I don't mind if others are eating non-vegetarian, but be in moderation. Correct. Be watchful.
Okay.
And if you have access to green vegetables, use them daily. In India and here also, green vegetables are available everywhere.
Yes.
So these green vegetables, the fiber in that prevent the toxins entering the body when you combine food with vegetables.
Vegetables, okay.
High fiber vegetables. So that is my exercise is very important because body has to.
How long we need to exercise, Dr. Garu?
You go for a walk for 15 minutes, half an hour.
Oh, okay.
Quick brisk walk is good enough. And check your numbers, because the numbers, the cholesterol number, triglyceride number, yes. It's something that you create in your body of your bad habits or good habits, 50%. 50% comes from your genes. I've seen some of my relatives or patients who are very lean, thin, exercises, but their cholesterol is 300, 400 because
My
that's
God.
come from the genes.
Oh,
So if that is the case, you have to do more, not to go close to fatty foods or fried foods. So diet and exercise are go hand in hand. And the other thing is go for annual checkups.
okay.
In here, you also stayed in America for some long time. Go for checkups. You know, not for fun, we prescribe the checkups. When you reach certain age, there are certain things you have to check.
So, at what age we need to begin, Dr. Garu?
I think about 45 years.
45 years,
And
okay.
50 years mammogram. If you have family history, even 45 years. But self-examination, and what is happening at an alarming rate in India, even here in the US, is because of the habits, food habits, or other habits. The incidence of cancers is moving to younger and younger ages.
Yes, that's right.
Younger and younger ages. That is breast cancer. We used to see them in patients at age 60, 65, 70, 75. Now in India, 20, 30, 40, 50 are the highest incidence.
Correct.
I'm fearful whether they reach 60 with these problems.
Correct.
So this people should be aware of that. And I have given a lot of planning to all the government, state government, central government. And I urge them to include, they have these packages, Arogyasri package, subsidized
Correct.
packages,
Yes.
treatment packages. I told them some of the state governments have followed my instructions, suggestions. Include these preventive screening in the package.
Wow, that's amazing, Dr. Garu.
Yeah.
Because
So-
there's not a lot of awareness back in India.
Yes. Breast mammogram is included. So people, they don't have to worry for, I don't have shell down money from it.
Yes.
Pap smear included. Prostate exam included. Chest x-ray included. This will save you more money later on.
Correct.
If you include these preventive screening protocols in the subsidized care. So that some of the governments followed. So that's another one. Go for checkups. And finally, not only cleansing your physical body, mental and soul, you do some yoga, meditation, and which is not expensive. You don't need to spend money on that. You can sit in your puja room, concentrate on God, whoever God is, in your book, in your mind. And that will help to cleanse the entire system. Physical ailments will be reduced to as minimum as possible.
Wow.
Because the basis for physical ailments is inflammation. Inflammation is due to body toxins. How do you get rid of that? Through yoga and meditation.
Wonderful, Dr. Garu. What was your first experience of Mahavatar Babaji Garu? Babaji Garu is Kriya Yoga master.
Yes. In the beginning, I don't know much about him. But what I did is, I'm a believer of, I'm a strong devotee of
Shirdi Baba.
Shirdi Baba for a long time, from my medical school. And I read about Mahavatar Baba. And next to my Baba's picture in my puja room is Mahavatar Baba's Baba. So I consider him as the highest spiritual leader.
Yes.
And not only that, wherever I go to hear discourses in India, all Swamijis, well-known Swamijis, they mention about Mahavatar Baba. Everyone, without exception. So my affection, my connection became very strong, where I put Baba's picture and Mahavatar Baba's, Shirdi Baba. Then I came, after reading and hearing discourses, he is also the biggest guru for Kriya Yoga.
Yes.
And then I started reading about Kriya Yoga, and I'm lucky that Aathmanandmayi is here, Mataji, with us here in my house today. I'm extremely blessed to have that opportunity. Amma, namaskar Amma. Welcome to my house. I'm immensely, intensely blessed by divinity to have you come to my house. What a blessing.
ఇక్కడ చూసిన బాబా గారు వెంకటేశ్వర స్వామి అసలు ప్రత్యక్షమైపోతా ఉన్నారనమాట.
ఇది బాలాజీ వాళ్ళు ఇచ్చారు టెంపుల్ టీటీడీ.
టీటీడీ వాళ్ళండి. ఎంత కఠోర తపస్సుగా చేశారండి అసలు. ఎంతమంది పేషెంట్స్ బెనిఫిట్ అయింటారు.
థ్యాంక్ యూ.
అటువంటి నిజంగా మీ తల్లిగారి ఆశీస్సులు, బాబా గారి ఆశీస్సులు.
మా పూజారంకి వెళ్దాం ఇట్టించి. ఈ ఇల్లు కట్టినప్పుడు ఈ రూమ్ ప్రతి ఇంట్లోనూ నాకు పూజారం కట్టుకుంటాను. అది కూడా ఈస్ట్ ఫేసింగ్ పెట్టించాను. సో బాబా మెయిన్ డేట్ ఉంటారు. అమ్మవార్లు అందరూ సిద్ధపురుషులు, గురువులు, మహావతార్ బాబాజీ. ఇది మోస్ట్ ఇంపార్టెంట్. మీరు రావటం అనేది నాకు పెద్ద బ్లెస్సింగ్ అమ్మ, పెద్ద బ్లెస్సింగ్. ఎందుకంటే నేను చేసే పనులు, గుడి వ్యవహారాలు, హాస్పిటల్ వ్యవహారాలు, నువ్వు చేస్తున్నది మంచివేరా అని దేవుడు సిగ్నల్ ఇవ్వటం, మీ పోటీ వారు రావటం మా ఇంటికి.
వైబ్రేషన్స్ చాలా బాగున్నాయండి అసలు.
నమస్కారం.
అద్భుతంగా ఉంది. చక్కగా మీరు ప్రతిరోజు ఇక్కడ కూర్చొని చక్కగా ధ్యానం చేసుకోవచ్చు.
చేసుకుంటాను. మేము ఇంక నుంచి కొంచెం ఇంటెన్సిఫై చేస్తాను. నాకు కావాల్సింది మా అమ్మగారికి కనిపించటం, పట్టు చీర కట్టుకుని కనిపించారు.
చూడండి,
పట్టు చీర కట్టుకుని హ్యాపీగా ఉన్నాను నాన్న అని. ఎంతోమంది మెడికల్గా నేను ఎంతోమందికి సహాయం చేయగలను. బట్ వాళ్ళకు ఉన్న అదర్ ఎలిమెంట్స్ అవన్నీ, ఆ పీస్ ఆఫ్ మైండ్ అవన్నీ రావాలంటే మా వల్ల కాదు. ఫిజికల్ మెడిసిన్ వల్ల కాదు, ఈ యోగా వల్ల. అది and the Kriya Yoga, then I read the techniques. I attended some of the classes.
Okay.
And last month when I was in my puja room, I got an internal message, a signal, whatever you call it.
Okay.
When I got an invitation to attend in a Bridgewater temple, Ammagari discourse.
New Jersey.
Yeah, New Jersey. I was not planning to come because I was busy, it's too far. I have so many other things on that day. But here in my puja room, he's not leaving me. Go and visit.
Wow.
Then I made a point that I told them I'm coming.
Could you hear Babaji Garu's voice, Dr. Garu?
Voice? No, it's internal voice. Your own voice.
Internal voice. Okay.
Your own voice.
Oh.
You sit there with clear mind. Some message is coming means it's Avatar Baba's message or Shirdi Baba's message. So then I attended that. Then I said, okay, this is the connection now. All these years of offering him flowers, pujas, and prasadam, the result is he is guiding me. Time has come to take instruction and continue what you are doing with a little more concentration.
That's amazing, Dr. Garu. When you first had the experience of being in the presence of Aathmanandmayi Amma Garu, what was your feeling?
She is embodiment of love, affection, and divinity. One thing I am very blessed is when I met her first time in Bridgewater temple. That smile, that Santi smile, is peaceful.
Yes.
I am here. That never left my screen in the brain.
Wow.
Usually when you see someone, you forget about the next day or the following day. It's not going away. That smile of intense love, peace, tranquility, imparting on you.
Yes.
Then when I heard that she wanted to stay in my house, then again I bowed to Mahavatar Baba. Okay, you listen to my request. She is here in my house. So this is all a God's creation.
Yes, Doctor.
The whole event, her visit to America and my invitation and Bridgewater meeting and then New Jersey meeting and here in our mandir yesterday in
Yes.
Plainview.
Yes.
These I consider is Shirdi Baba showing me the path. You have...
You immediately had announced about offering your temple as a center to
Yes,
our
yes,
foundation.
yes.
So, what was that inner call that made you to announce?
Yeah, inner call is because I believe in Kriya Yoga. After reading, after seeing, after practicing a little bit, now I practice a little more intense. And this is easy to do.
Yes, yes, Doctor.
And you don't need any asanas, this and that. They're very elaborate procedure.
Correct.
There's no big protocol.
Correct.
And then anyone can do that.
Yes.
And depending on your availability of time, you do accordingly.
Yes.
And slowly, just like any other procedure or process, you intensify as you go along.
Yes.
All these opportunities are there. And this, I have no doubt, it is helpful for your physical, biological systems, but even mental and soul and spirituality. And this is free of cost.
Yes.
Nobody is asking you to give your credit card.
Yes.
So then you must be out of your mind not to participate, not to start doing it.
Correct.
So the more you do it, whatever little I do, my prayers with Baba, Shirdi Baba, the more you do it, the more intense you can be.
Yes.
And the effects are very profound. You will see the physical effects.
And very instant also.
Instant.
If we are able to practice the Kriya for 49 days, immediately we are able to experience
Yes.
a lot of benefits.
Yeah.
Dr. Gar, another important question is that for the patients who are in the 4th stage of cancer, is there a cure? Can it be cured actually?
10 years ago, difficult.
Okay.
Now, there is cure. Because what we did is for many decades, now I'm talking as an oncologist, a researcher, we believed that how cancer develops is not due to multiplication of the DNA in the center of the cell.
Okay.
Any cell has a central DNA
Yes.
and a periphery, a membrane, cell membrane,
Yes.
periphery.
Yes.
We thought that the central DNA is multiplying because of unknown reason, this and that. You give chemotherapy, radiation, stimulate, it's cured. But that understanding was totally wrong, what we had 4 decades ago.
Okay.
We have proved, and it is 100% beyond any doubt, is for the DNA, central DNA, to get a stimulus to multiply is coming from the cell membrane.
Okay. Oh.
Their cell membrane, receptors on the cell membrane.
Mm-hmm.
I give the example of a bicycle wheel.
Okay.
The central hub and the spokes.
Spokes, yeah.
And the rim. From the rim, the signal to the spoke is sending to the DNA in the center, multiply.
Wow.
Another spoke is giving a signal to the central nucleus, get your own blood supply, telling the cancer cell. The other signal is giving, go to the liver, you are sitting here, you're supposed to go to the liver, metastasize, the brain, lung, bone. So each signal
Okay.
is giving a bad information to the central DNA. So that we realized, we proved that. So what we did is next generation about 15, 20 years ago, signal blocking drugs.
Oh.
If you block with a medicine, with a pill, this particular signal, the capacity for the central nucleus stops to multiply.
Okay.
If you give another pill for this signal, it will not produce its blood supply. So if there is no blood supply, it cannot survive. It will not go through liver or lung, no metastasis. So each signal. So these are called designer drugs or targeting drugs. We are targeting the signal. That has cured so many people in the last 15, 20 years. That's where I tell you one signal. I get a lot of patients from India too. People with lung cancer or stage 4 cancer. When we do this analysis, which signal is bad in them, it's called next generation sequencing. In that it will tell you this signal is bad. There is a medicine we developed for that signal, which is a pill, not even injection. By giving that pill, the signal stops and the cancer gets controlled or cured. Stage 4 lung cancer, patients from India. They never smoke, but ladies do get cancer of the lung, the stage 4. And we found out this particular signal and put them on that medicine, oral pill. The entire thing goes backwards and it comes to normal. There are so many people who were not supposed to live about 20 years ago, now living 10 years, 15 years. It will control all the cancer. And then may appear after 10 years, but we will have another medicine for that. So, but this is never heard. Stage 4 lung cancer patient surviving, doing her own work, contributing to the society. So those are all the miracles of modern medicine. There is another CEO of a big cancer hospital in Hyderabad.
Okay.
He has stage 4 lung cancer.
Oh, okay.
Never smoked, maybe moderately smoking history. And we did this next generation sequencing. Then we found out that he has one particular gene which got berserk and then producing the cancer.
Okay.
This particular gene is called ALK-Positive. ALK means anaplastic lymphoma kinase gene.
Okay.
What is this gene? Why am I mentioning about that gene? This particular gene is very important when you are in our mother's womb.
Okay.
This gene is very critical to develop your spinal cord.
Oh, bah. Okay.
So why it is acting up like this? This gene is supposed to produce the spinal cord and become inactive in the womb.
Okay.
But it did not become inactive.
Okay.
So it showed up 40, 50 years later. It got activated and produced lung cancer. So if you know that his lung cancer is due to this gene, we developed a pill for that. He took that pill, he is now 5 years without evidence of any cancer anywhere in the body.
Since you mentioned about this, Dr. Garu, Amma Garu has also introduced about Garba Samskar. Garba Samskar is for the infants in the womb. This is also a very special initiative which is being propagated and disseminated by Divya Babaji Sushumna Kriya Yoga Foundation.
Yeah.
Under her supervision, we are taking this initiative forward.
Very good project. Good project, because God has created these genes to produce organs when we are in the womb of the mother. They are supposed to become inactive, but some of them will not become inactive. So maybe this kriyas, the program, will make their function and then become functionless after the purpose is over.
When you mention this, I can only think of the Srushti and the Laya.
Yeah.
It all happens on a other realm, I feel.
Yes, yes.
Dr. Garu, you spoke about targeted therapy. Could you enlighten about immunotherapy also, Dr. Garu?
I just spoke to you about targeted therapy or designer therapy, designer drugs. I gave you the example of a bicycle wheel with the central hub, which is nucleus, and the spokes and the peripheral rim.
Yes.
The signals are coming from peripheral rim through the spokes to the center to do all kind of havoc in the body, the cancer development, metastasis and all that. I also mentioned before that there are designer drugs, targeted drugs developed by us. Each drug will knock off the signal, that telling the nucleus, don't do that.
Okay.
There's no reason to do that. No reason to multiply for a normal cell. So each signal has a particular function to regulate the cell.
Okay.
Then intuitively it comes to everybody's mind. Each drug is only acting on one signal only.
Okay.
The cancer is more complicated and more nastier or more cunning than what we think.
Yes.
So each signal is knocking down one signal, each medicine. How about anything that works on all signals?
Yes.
All spokes going to the center. That is immunotherapy.
Wow, that's wonderful.
Immunotherapy enhances your own body immunity.
Wow.
And fights the cancer. Turns off all the signals.
Okay.
That is the reason immunotherapy is a game changer. What happens is, as cancer develops in the body, it releases two nasty substances. I won't go into more detail. One is called CTLA, the other one is called PDL1. Consider them as two nasty substances developed by cancer in the body.
Okay.
These substances will destroy the command and control center of the body, which is your immunity. Their function is to knock down just like in a military operation, knock down the command and control center.
Yes.
That is, your immunity is down. So it can do all kinds of havoc in the body. So what we did is we developed, two scientists developed anti-immunity and anti-antigen drugs called checkpoint inhibitors.
Okay.
What is checkpoint inhibitor? The cancer cell is producing a check on your immunity. So these drugs are called checkpoint inhibitors. They are available now in India and also here.
Okay.
What these drugs do is it releases the check that is produced by cancer on your own immunity. Okay. So the way they are effective, the way they function is different from chemotherapy. They don't destroy the cancer cell, these new drugs.
Okay.
They don't do anything. They do improve your body's immunity.
Okay.
And they're called brake-releasing drugs also. The brake placed by cancer cell is released by these drugs. They are doing wonders now. With this type of responses, cures we have seen now, we have never seen before. Stage 4 cancers, you asked me before.
Yes.
Cancer is completely wiped out with these drugs.
Wow.
So that's the reason they are called game changers, game-changing drugs. And a couple of examples of how they are helping is Jimmy Carter, or President of the United States, ex-president. He developed a kind of cancer, aggressive cancer, which has spread to bone, lung, liver, brain, everywhere.
Oh my God.
And we put him on these immunotherapy drugs, checkpoint, brake-releasing drugs. And he's 101, 15 years later. There's no evidence of cancer anywhere, but he's in the nursing home because of his old age.
Okay.
We never thought in the 20 years, 15 years ago, that if you stimulate your own immunity, body immunity, you can keep even cancer away. So that is such a, what you call, game-changing information. we have.
It's amazing.
And American companies, pharmaceutical companies, are spending at least 500, 600 billion on research. So this is something everybody should be aware of. And ask any patient, ask your doctor, am I a candidate for immunotherapy? Right now, a little expensive in India, but not that expensive. It is being used right now.
Okay.
Cancers, but I want more and more doctors to utilize that. And coming back to what we started with, Kriya Yoga, Kriya Yoga is another method, in my view, to stimulate your immune system.
Wow.
No doubt about it. Because the immune system sometimes fails in our body, not because of cancer, it happens because of cancer also. But the stress and anxiety and what we go through every day in this materialistic world is too much for the body to handle. So immunological status fails.
Okay.
Equilibrium fails. So this is useful, in my view, to keep cancer away also. And also for those patients who are receiving type of chemotherapy, drugs, chemotherapy, radiation therapy. Along with that, your chances of improving outcome is significantly better if patients combine the regular treatment, the routine treatment, standard treatment with yoga also.
Yes.
Kriya Yoga. The Kriya Yoga, I'm talking about it for the last few weeks now, more and more, after my interaction with Amma, will enhance the effect of whatever therapy you are taking, because it will produce the kind of positive vibration in the body and control, detoxify all the toxins. And I have no doubt, I have been an oncologist for over 50 years.
Yes.
And Kriya Yoga will greatly supplement and complement whatever you are receiving as cancer therapy.
My goodness, that's great.
No, I have no doubt about that.
Yeah.
And the Sushumna Kriya Yoga, which is a very simple technique with a profound benefit, will definitely, in my view, I have no doubt to say that it will complement your treatment, whatever treatment you are getting. So please do learn from one of the gurus or online, or it's a simple technique. You don't have to pay anything, it's free.
Yes, it's free for all.
Free for all. And our Mahatmas or Swamijis or Mahavatar Baba and Amma is giving this divine knowledge free to all of us. So take advantage of that. Make your treatment more beneficial to you. And even the symptoms occur due to chemotherapy can be reduced to significantly low levels.
Absolutely, Dr. Especially because it's a gift from Bhognath Siddhar Garu, who himself is an expert practitioner of Siddha medicine, and he lived for 12,000 years.
Yeah.
Dr. Garu, finally, the last question is, nowadays we get to see a lot of youngsters getting into a lot of addictions, especially drug addictions, alcoholism, and also smoking. So what do you have to say about this? How do we control?
How do we control is education, through education. The education should start very early.
Okay.
About the risks of all these nonsensical drugs,
Correct.
alcohol, cigarette smoking. It has to start very early.
Correct.
Once you go to high school level, college level, it's too late.
Yes.
I remember one small statement my daughter made. I used to teach her when she was in high school. Amma, these are things should not be. You tell your friends not to smoke, not to do this. She told me one line, one sentence. Daddy, it's too late.
Oh.
Too late for the kids, but she's okay to teach there because it's too late. It's high school. They should have started this education early.
Much early.
Yes. So we need role models for them to follow. And education, the health education or awareness should be in elementary school or even middle school level. And purely awareness education. Now it is, they are showing, and I see that in Indian TV also, what can happen if you smoke for a long time. There's some, cases of lung cancer, emphysema, all that you are showing on in the media section of the movies. When you go for a movie.
Yes.
During intermission, I think.
Oh my God, that is so repulsive. Every time we go to watch a film, I mean.
Yeah. So that should start at home first.
Yes.
At home first. And at home means you, father and mother, everybody should be role models for the kids.
Correct.
If there is no Shanti at home, you cannot expect others to follow.
Correct.
And then ask kids to attend the religious functions. They should not feel shameful to do that.
Yes.
The more temples in America, I feel happy. There are a lot of temples in every city. That is very helpful, and a lot of kids are attending the classes. I give a long answer for a short question, but it's very disturbing trend.
Garu. Yes.
Disturbing trend.
Correct.
Yeah. And not only the habits because of the alcohol, smoking, and drugs, even diet, obesity in adults, youngsters is very big in this country. They are supposed to be next generation citizens, but what can we expect from them? And they may not see their 40s and 50s.
That's right.
I don't want to leave with a pessimistic statement. Things are happening.
But Amma always says, Dr. Garu, Jantu Nam Nara Janma Durlabham. Amma keeps quoting that. This human life is a blessing. It's a gift from divinity. After so many long years of evolution, finally we have attained this body, and we have to stay healthy. We have to stay physically healthy, mentally, emotionally, and also spiritually healthy. That's what Amma keeps telling. So what you say is also extremely important, and this awareness has to spread across.
Yeah.
Thank you so much, Dr. Garu, for joining me
in
this special interview.
Thank you for giving me the opportunity. And I'm very, very happy that you're all here with us, with me in the house.
Thank you, Doctor.
With Amma Garu. And I consider this the greatest blessing for me.
Thank you, Dr. Garu. Mangalam Nitya Shubha Mangalam.